for joining us today for the first session of the Campbell Collaboration webinar series. The webinar series serves as a platform for the Network members to share experience and expertise in evidence synthesis and to learn about potential collaboration. My name is Zahra Said. I'm a research assistant at the Secretariat, and I will be moderating the session today. So before we begin, and if you are using the GoToWebinar for the first time, as you might have noticed, you are automatically muted. So if you would like to submit any comment or question, please use the tab on the right. Or if you would like to comment or address your question to our presenter directly, you can use the raise your hand button and we can unmute you and you can discuss directly with our presenter. So today's session is about using evidence for a better policy, the Campbell Collaboration and the 4 waves of the evidence revolution. And our presenter for today is Howard White. Howard White is the Chief Executive Officer of Campbell. He was previously the founding Executive Director of the International Initiative for Impact Evaluation, 3IE, and has led the Impact Evaluation Program of the World Bank's Independent Evaluation Group. Howard started his career as an academic researcher at the Institute of Social Studies in The Hague and the Institute of Development Studies at University of Sussex. As an academic, he leans towards work with policy relevance and working in the policy field. He believes in academic rigor as the basis for policy and practice. His other interests are running and walking, preferably long distances in remote places, and reading English history. Thank you, Howard, for joining us today. I will leave the floor to you so that you can start your presentation.
Okay, thank you, Zara. So I trust everyone can see my screen now, and if not, then please shout out. So as Zara said in the introduction, I'm going to be speaking about the evidence revolution that's happened over the last 25 years or so, and pretty much across the world. I'm going to explain how it's rolled out over time, and then talk about the way in which Campbell in particular has been engaging with his evidence revolution. Okay, so what many of us are aware of is that the language of evidence is spreading to all sectors. Of course, evidence-based practice is most firmly embedded and has been most embedded for the longest time in the health sector. So it's not surprising to find that we have, for example, books on evidence-based nursing. But we also have books on topics like, so I'm just trying to clear my screen. We have also books on topics like evidence-based business. So this is a business management guidebook based on evidence from randomized controlled trials and reviews. We have evidence-based teaching, and it's something I'll be talking about a bit later on. We have evidence-based art therapy. We have evidence-based social work, so a growing number of studies in various areas of social work practice. Evidence-based policing, which is actually, to my surprise, one of the strongest areas of use of evidence outside of health is in policing, where you have in Anglo-Saxon countries, in UK and US, Australia, New Zealand, Canada, you have a strong connection between practitioners, police force, and researchers, where they hold joint events, do joint research, and so on. We have evidence-based sports and for speed and agility. So if you want to practice football, basketball, whatever, then there's evidence-based ways in order to improve speed and agility. I actually have this book. It's quite interesting because it starts at the start by saying it used to be felt that sort of speed or agility were innate characteristics that people had or didn't have. There wasn't much you could do about it. So you could have practiced technique, like how to shoot a goal or a basket, but you couldn't do anything about speed or agility. But then studies showed that really wasn't true, and there are things you can do to improve any person's speed or agility with scheduled training exercises, and that's what this book describes. And finally, we even have evidence-based cookbooks. So James Wong's cookbook, another book that I also have. I do have most of these. Um, James Wong's book is based on randomized control trials and systematic reviews. In the introduction to the book, you will find the evidence pyramid with RCTs and reviews at the top, and it has advice basically on how to which foods are most nutritious in terms of micronutrient content. As a general rule, more purple it is and less green it is, the healthier it is. So many vegetables like cabbage and lettuce go on a scale from green to purple, and the more purple it is, the better it is in terms of micronutrient content. But also how to prepare the food to make the micronutrients in the food bioavailable, because many ways of preparing food actually destroy the micronutrients, or even if they're there, our body doesn't absorb them. So there are tricks like adding pepper to turmeric. Turmeric's great. Add pepper to turmeric, add mustard to broccoli, that makes the micronutrients in those various foods bioavailable. So evidence is across all sectors, from health as we know, but across social sectors of education, policing and so on, but into sports, lifestyle, and even cookbooks. So language evidence is really spread. And so the question is, well, how did this happen? How did we get here? And how can we do it better and ensure that evidence is better used? And that's the way in which the four waves of the evidence revolution have unfolded. The first wave is the results agenda, which goes back to the 1980s and the 1990s in particular, and was associated with new public management, which was very much, again, an Anglophone thing, prominent in US, UK, Australia, Canada, New Zealand, particularly prominent under the Clinton and Blair governments, where the idea of new public management was to try and instill some sort of private sector orientation to public sector organizations. And one way of doing that was to have a focus on what were called results. And so prior to that, the way in which performance was measured in the public sector was very input oriented. So basically, have we spent the money? My first job was in the planning office in Lesotho back in the mid 80s, and it really was the case that we would monitor the development projects that are under our purview by basically saying, have they spent the budgets? Are they on track? We might look at some things like, have they hired the consultants? Have they bought the Land Rovers? Whatever. But that's about as far as we got. We really focused on inputs, not on the outcomes. Lifting people out of poverty, reducing unemployment, increasing empowerment, and so on. And so the shift to focusing on outcomes that happened with new public management, what are being called results, is a good thing. And in international development, it got manifested itself in, first of all, international development targets, for those that can remember those, and they got replaced in 2000 by the Millennium Development Goals, which of course now been succeeded by by the Sustainable Development Goals. And this focus on outcomes is great, because focus on outcomes is better than just focusing um, on inputs, but there's a very serious shortcoming or limitation to this approach. And I'm going to say what that is shortly. But first of all, it doesn't mean that we shouldn't do outcome monitoring. Monitoring of outcomes has its role. Here's an example using data from Kenya, where they have a district level monitoring system. So it's a management information system, basically, which is producing outcome data on open defecation free status of communities. And there's a color coding scheme shown in the bottom right of the graph, which, where basically where less than 20%, 25% of communities are open defecation free, then it's shaded in red, and if it's over to 75%, it's shaded in green. And you can see that basically, the target, of course, is 100%. So you can see if it's just that central strip around Nairobi and a bit over in the west on the Ugandan border, which are green, most of the country is red. And so what this clearly tells you is that Kenya's goal to be 100% ODF is just not being achieved, and more needs to be done about that. So you need to have more programs or better programs to try and achieve open defecation-free status in communities across Kenya. But importantly, it doesn't tell you what to do. Clearly, you're not doing enough, you're not doing the right things, you can tell that, but it doesn't tell you, okay, what should you do to turn all these reds into green? So the fact that I'm a bit down on monitoring data because they can't tell you if programs are working or not, I'll emphasize in a moment, doesn't mean we shouldn't use monitoring data. It means we should know what we can do with it. And I think monitoring data are very good for advocacy. They're good for identifying problems, and they can help you design programs, or at least know where you should target programs. So um, advocacy strategy program targeting. So a common example I use, which is coming up at the end, sorry, going in reverse order here. Common example I use is early marriage. I was in Bangladesh just last week, and in Bangladesh, nearly half girls are married by the 18th birthday. If you go across many developing countries, much of Africa, India, for example, around a quarter of girls are married by their 18th birthday, but in India, in Bangladesh, actually close to half of girls are married by their 18th birthday. Early marriage is bad. Early marriage is bad because girls who get married young tend to have less agency in the relationship, but also very critically, because girls that get married early have their first birth at an earlier age. And children born to young mothers are at greater risk of both cognitive and health deficiencies, and indeed greater risk of early death. And mothers giving young at an early age also have greater risk of complicated deliveries and indeed maternal mortality. So early marriage is a bad thing. Um, and if it was a bad thing, and okay, it was 1 or 2% of girls were getting married early, okay, it's a bad thing, but it's not very common. But it's nearly 50% in Bangladesh. It's around 25% in India. It's around 25% in much of Africa. So you can actually say it's a bad thing, and it's a really big problem. And we do think it's a bad thing. There's a lot of it around. Prevalence is very high, and of course, so this is useful for advocacy. So it's an advocacy issue. You can go to government and say it's nearly 50%. It's a big issue. It's good for strategy because if you're an organisation interested in girls, youth rights, empowerment, early marriage is one of the key issues you should be focusing on in your strategy. And it's good for targeting because you can identify those communities where prevalence is highest and say these are going to be our clear target areas. You're not going to worry with middle class girls who've got education, going to tertiary education, they don't have high rates. Actually, look at the data in India, it's very striking. The age of first marriage for that group of women is getting pushed back into the early 30s now. And so it's really getting later and later. But women in rural areas, women from lower social economic status have high early marriage rates. And so that's where you want to focus your efforts. Um, so I need to tell myself to move on. A good example of this is Pratam, an Indian NGO that does an annual state of education report. The ASA tells you, showing the data here, that 5 out of 10 children in rural India at standard 5 can only read at standard 2 level. It's not that 5 out of 10 can't read at their appropriate level. 5 out of 10 at standard 5 cannot read at standard 2 level. Similarly, if you look at the bottom half of that figure, you see that only 2 out of 10 of children in rural India at standard 5 can solve a simple 3-digit division sum like 405 divided by 5. Only 2 out of 10. So those data tell us there's a serious learning outcome problem in rural India, but those data don't tell us what to do about it. Just like knowing that there are 50% of girls in Bangladesh married before they're 18 doesn't tell us what to do about it. So the problem of outcome monitoring data is it doesn't tell us what works. When we use outcome monitoring data and we see the outcomes improving during the course of a program, that doesn't tell us that that program's causing that change, because of course there are many confounding factors that cause outcomes to change anyway. So these outcomes are changing anyway for these for these for these for this whoever the target group are, and it may not be anything to do with the program. So outcome monitoring doesn't tell us what to do to end child marriage, reduce teenage pregnancy, increase yield, alleviate poverty, and so on. So how do we know what to do? We know what to do by using impact evaluation. And so by the early 2000s, several organizations invested heavily in results frameworks, outcome monitoring, like USAID, DFID, and so on, realized this isn't telling us what we want to know. This isn't telling us actually what programs we make. I haven't got it in this presentation, but the General Accounting Office in the US, which oversaw USAID's report monitoring, wrote a letter to USAID in 2002 saying your outcome monitoring, your results reports do not tell us what difference your programs make. And in response to that, USAID stopped results reporting of development outcomes as being USAID results. They said they're not to do with us. We're not going to report them as results any longer. And so that realization led to the search for, well, what do we do to measure what difference our programs make? And of course, we all know the answer to that. The answer to that is impact evaluation, where you have a study design that compares what would have happened with what happens with the program to what would have happened in the absence of the program. You do some counterfactual analysis. And that counterfactual analysis is most commonly done where possible by a large N statistical quantitative design we call impact evaluation, and very preferably, if it's possible, using a randomized controlled trial. So as Zara mentioned in the introduction, I set up and ran 3IE for some years, and we were basically a global grant making body for impact evaluations and reviews. And so during the time I was there, we funded around 200 reviews. But outside of that, you'll see even huger growth. Sorry, you 200 impact evaluations. You'll see even huger growth in impact evaluations. So the graph shows that around early 2000s, there are around 50 studies a year being done of development interventions, mostly in health, and that number grew steadily. So by 2012, there are over 500 studies being published a year. So a tenfold increase in impact evaluations. That's a massive increase. And this number hasn't tailed off. It's just an indexing issue that makes it look like it's tailed off. But if you actually update for searches, you'll find that you've got a continued increase in impact evaluations over the years. So let's just take a look at one. This is one funded by 3IE, carried out by JPOW, on extending secondary high school to uh, uh, making it free in Ghana. So across the world now, we've pretty much achieved universal primary education. There are some hard to reach groups, nomadic populations and so on, street connected children that aren't in school, but by and large, we've achieved UPE. So the question is now, how can we get children to secondary school? We know from the historic experience of countries like South Korea and so on, you need children educated to that level, secondary level, to really get sustained growth in your economy. You need quite deep investments in human capital to see sustained growth. Actually, Bangladesh is a very good example of that in recent years. But historically, it's been China, and before that, South Korea and so on. So how do you get children into secondary education? So this was a randomized controlled trial that basically identified children that had been allocated places to go to secondary school but not taken them up, and offered them free places by paying their fees for them. And it was a randomized control trial because some were offered it and some weren't offered it. So there was an effect on enrollment, but it wasn't everyone offered the it wasn't 100%. It wasn't 100% for two reasons. One was that some of the control group who didn't get the subsidy also went to school nonetheless. They're often delaying a year, and some that got the subsidy didn't go, and I'll come back to that. There was an effect on test scores, but only for females, and that's because this problem of learning outcomes is pervasive across developing countries, and so there's an issue around the effectiveness of secondary education. It also needs to be addressed if you're going to pay money to let children go there. And importantly, there's also an effect on teenage pregnancy. So there's always been a discussion around the protective effect of secondary education, that girls who are in secondary education are less likely to get pregnant. We've known that for years, but we've never been able to untangle direction of causation, because girls drop out of school when they get pregnant. So is this a relationship going from getting pregnant to dropping out of school, or is it actually genuinely staying in school makes you less likely to get pregnant? This study can answer that question because it is a randomized controlled trial, an exogenous increase in being in school, and so we see there really is a protective effect from secondary education. So girls getting the secondary education are less likely to have sex at all, and if they do have sex, they're more likely to practice safe sex, resulting in fewer unwanted pregnancies. So this study has quite a lot of interesting findings, and it clearly has some very interesting policy implications, because, as I said, not everyone that got the subsidy attended school. So there's some for that group. There's some other constraints, not just the fees, that's stopping going to school. It might be the additional cost, like uniform costs. It might be the location, because you have to send the child away to the town where the school is, and they haven't got a relative there to send them to stay with. Something like this. So there's some other constraints that need to be identified through some formative research if we're going to reach that population we've not reached with the subsidy. But also, many who got the who didn't get subsidy still went to school, but they may have delayed a year. So in effect, we were giving the subsidy to people who actually didn't need it. They would go to school anyway. So that would suggest some means testing of the subsidy might be justified. And finally, there's a social benefit to this, because reduced fertility is a social benefit. So there's a social benefit to this intervention, which does justify giving a subsidy. Just in simple economic terms, with a social benefit, then you can justify subsidy. So this is I think, quite a nice example of a study that gives policy implications for Ghana, which was in this situation, having universal primary education, but having low rates of secondary enrolment. So what to do about it? And other countries in that context might learn from this study. But in general, we wouldn't want to take a single study and use that to inform global policy. And that brings us to the third wave of the evidence revolution. The second wave was the growth of impact evaluations, which took place during the 2000s, first decade of this millennium. But the third wave is saying, well, we've got this growing number of impact evaluations. Now, how can we learn from them? And we don't want to learn from single studies. Very quickly, 3 examples: mandatory arrest, where the police have to arrest the suspected perpetrator in cases of domestic violence. A randomized controlled trial of Minnesota in 1983 showed there to be a very effective program that reduced reoffending, and it got taken to scale by 2000. 75% of police districts have mandatory arrest programs. So that sounds great, evidence-based program, but it's not so, because 5 further randomized controlled trials in 5 different locations did not replicate the finding. In a couple of cases, mandatory arrest was worse than the alternatives. And what we know now from diving more deeply in the data is that this intervention, mandatory arrest, is effective with employed middle-class males, not so effective unemployed lower-class males, often black, who have repeated encounters with the law, repeatedly get arrested anyway. So putting this intervention in place doesn't make much difference to them. And so we've dug down deep into data, and we understand the context in which this might be effective. Just taking to scale based on one RCT in one city was not a good idea. Secondly, nurse family partnership is what's called a branded program. It's a home visitation program from young mothers from disadvantaged backgrounds to give them advice on how to raise their children. 3 randomized controlled trials, they're there listed on the screen, in New York in the 70s, Tennessee in the 80s, and Denver in the 1990s, showing the program works. But this web page comes from the Australian Nurse Family Partnership, and they say, well, we know it worked in the US, so we're going to do it in Australia. But this web page doesn't mention the study in the Netherlands of nurse family partnership finding weak effects, and the study in the UK, which had been published in the Lancet when I took this screenshot from this web page, showing no effects of nurse family partnership. And why is that? Why did it work in the US but not in the UK? A very plausible explanation comes from the context, which is what happens to the control group. Because the control group gets usual services. If you're living in the Bronx, well, I not living in Bronx, living in Elmira in New York, and you're a disadvantaged mother, what are your usual services for advice on how to bring up a child? They are nothing. So this intervention works compared to getting nothing. If you live in the UK, every mother gets free antenatal care. Every mother gets free hospital delivery. And when you take the child home, a health visitor visits you once a week to check on the child and give you advice on raising the child. That's the same as nurse family partnership. So every mother in the UK gets the program anyway. So adding the program makes no difference. So we can see in that case very clearly how the difference in the context limits the transferability of the study findings. And we have to look at the global evidence base to say, okay, it worked there, didn't work here, let's understand why, so we can understand to which settings we can transfer the findings about this program working or not. And that's what a good systematic review will do. It won't just say, it won't look at the average treatment effect, say, well, average it works, doesn't work. It will say, there's heterogeneity here. Let's dig down and understand why it works, where it works, and why it works there and other places. Finally is deworming. So there's a well-known impact evaluation, randomized control trial from Western Kenya, one district of Western Kenya, showing that deworming has benefits not just in reducing the worm burden, but also improving a child's health, nutrition, and their school attendance. And this one study has been very influential in the Deworm the World movement. But, and not only Kenya, but for example, several states in India have adopted school-based deworming programs based on the findings from that study. And you go to, for example, the web page for the Bihar State school-based deworming program, it says evidence from around the world shows that deworming improves children's health, nutrition, and educational status. They say that evidence around the world shows that deworming improves a child's nutrition, health, and education status. That statement is simply untrue. Evidence from around the world shows no such thing. It shows no impact on those outcomes whatsoever. And indeed, there are 12 studies from India showing no studies or no effect on those outcomes. So it's very weird that a government in an Indian state would base their policy on study from Kenya when they're actually Indian studies showing no effect. So they're both Cochrane and Campbell reviews of deworming showing that basically the vast majority of studies, over 60 of them, find no effect. Meta-analyzed effect sizes are generally zero, with the exception of 3 African studies, of which this Kenyan study is one. We have not been able, in that study, to explain, and the lead author's on this call, so you can ask her about it later, not in that study been able to explain this African exceptionalism. We really like to be able to, and we can't. So have not been able to give as clear a policy steer as we'd like. But what we do know is that you've got to have improvements in the wash environment, as we're all doing around the world now. But we know you have to have improvement in the wash environment in order to get sustained reductions in the worm burden. Otherwise, children just get reinfected. So don't rely on single study, rely on reviews. And the third wave of the evidence revolution has been this huge rise in systematic reviews in the last 10 years. So you go back to the 2000s, roughly 10 reviews being published in international development a year. By 2016, over 100 reviews being published a year. And there 3i really did play a role because there were no international development reviews being done outside of health, really, prior to 3i being set up. Our first ever call in September 2008 was for systematic reviews. And we funded 200 reviews during my time there. And so you see there's big growth in reviews coming up, and they've become very, very common now. And of course, Jessie is a testament to that, and the role of Jessie is a testament to that. And of course, Jessie does have its foundations mostly in health systematic review centres, but we're working with some of them, like in Macquarie, to expand into non-health sectors. The health emphasis is important because there is still an evidence shortfall. So if you look at randomized controlled trials, in education, they're around 1,000 globally. In social welfare, they're around 750 globally. This includes developed countries. Whereas if you look at the Cochrane clinical trials database, they're 1.5 million clinical trials. So a huge difference. Look at systematic reviews, they're around 1,000 reviews based on a simple Scholar Google search for having systematic review in the title or abstract. For both education and social welfare. Epistemonicus, the health effectiveness database, has 38,000 systematic reviews. Cochrane has around close to 9,000 reviews now. So just many, many more reviews in health than there are in other areas of other sectors. There are also geographic gaps. We've been working on a number of evidence and gap maps. Here's an example of one we've done with IIT in Delhi on road safety, for the International Committee on Road Safety, Independent Committee on Road Safety. And we call this a geographic gap because 93% of, sorry, 93% of road deaths, according to UNICEF, to WHO, take place in low middle income countries. But over 90% of the evidence comes from North America. So that raises a question of whether the evidence from North America is transferable to the settings in sub-Saharan Africa, in South Asia and so on, where we don't have any studies. That is an issue I've written a blog on. I won't go into it now. Please have a look at the blog on the Campbell website if you want to know more about where we think some studies are transferable, but some studies aren't. So the evidence mapping approach, another form of evidence synthesis, also highlights evidence gaps, and I'll say more about evidence maps in a bit. So we're interested in this evidence-driven project cycle, and I have a presentation that takes 2 days to go through this cycle, so I won't do that here. I'll focus on just this top bit where we're saying we're consulting the evidence base to inform new studies and new study design. And the main way in which I think we should be doing that, which I call knowledge brokering, there are 2 ways of doing it. One is customized direct interaction, which I call the Nordic model. I'm not going to speak about that. There's not time. Happy to answer a question about it. The second approach is institutionalized use evidence through knowledge brokering platforms. I call the what works model for reasons that will be obvious in a moment. So this is the key point. So I have this pyramid. This is not the normal evidence pyramid of RCTs at the top. And you go up this pyramid doesn't mean higher up means better. Higher up this pyramid means the evidence is more heavily brokered or translated. The knowledge is more heavily translated or brokered as you go up the pyramid. So you have raw data at the bottom that gets analysed or translated into studies. Those studies get analysed to be summarised in reviews. All of the studies and reviews get curated to go into databases and maps. You can put all these resources onto platforms, but most importantly, you have portals, guidelines, and checklists. And the important thing about the top layer of the pyramid is these are evidence products that allow decision makers to make decisions without having to go back and look at the underlying research. If you're a researcher that's going to do a great research study, be it a review or primary study, and you think I'm going to publish my study in a top journal, and then policymakers are going to read that article and change their policies, that's a really bad theory of change. It doesn't work like that because policymakers don't read academic papers. And the problem with, the issue with evidence platforms, evidence maps and databases is they take the user back to the academic studies. Users, policymakers, decision makers don't read academic studies. So the point about the top 3 layers of the pyramid is they allow decision makers to make a decision based on evidence without having to go and look at the evidence. And evidence portals say, here's the evidence, you decide what to do. Guidance says, we've looked at the evidence, we think you should do this, and recommendations. And checklists say, we've looked at the evidence, just do this. Don't think about it, just do this. So the degree of agency gets less as you go up the pyramid for decision maker, and the extent of curation is heavier. The brokering is heavier to get to that evidence product. So this system is best institutionalized in health. So the World Health Organization produced international guidelines on different topics, like deworming, for example. In the UK, NICE is the equivalent of WHO, but just for the UK, it produces guidelines. And so WHO has guidelines on producing guidelines. It's called the Handbook for Guideline Development. And in the guidelines on producing guidelines, WHO says WHO guidelines have to be based on high quality systematic reviews. And so there you are, institutionalizing with evidence from reviews. So organizations, Ministry of Health around the world that adopt WHO guidelines are using evidence based on reviews without having to go and look at those reviews or even knowing what a systematic review is. Now, that's an example of guidelines and using guidelines, deworming guidelines is an example of that. Here is an example of evidence portal. So I think this is the best website in the world for reasons that hopefully will be clear in a moment. So I like it a lot, obviously. So this is from the Education Endowment Foundation, which is the What Works Centre for Education for England. And they identified in EEF, in consultation with teachers, 38 different interventions, arts participation, aspiration, and so on, interventions that they thought would improve learning outcomes for disadvantaged students. And for each of these 38 interventions, they commissioned what? They commissioned a systematic review. And based on that review, they then produced this evidence portal. So if you look at arts participation, it presents the evidence in 3 simple metrics. How much is it going to cost me? How good's the evidence? And what's the impact? And the impact means what's the impact on learning outcomes for children who get this intervention compared to comparable children who don't get this intervention. So children going through a school of arts participation come out of that the end of the year having 2 months of better learning outcomes to comparable children at comparable schools, except they don't have arts participation in their curriculum. So that's a pretty large impact for including arts in your curriculum at moderate cost. You can sort by that last column, and you can see that giving your child feedback has a huge impact, 8 months, nearly a whole school year, on a child compared to children, comparable children that don't get feedback, and it's very low cost. And you can reverse sort, and you can see that repeating a year is very expensive and actually sets a child back by 4 months compared to what they would have been like had they not repeated the year. So they actually ended up worse off in terms of their learning outcomes than if they hadn't repeated a year. And so that's a very clear tool. You can click on any intervention and dig down and read more about the intervention. You can read actually about some of the challenges in implementing the intervention, and you can click down and read the systematic review, but you don't need to, because this tells you all you need to know. And why this is so wonderful is not just the way it summarizes the evidence, but a study carried out 5 years ago by the National Audit Office found that 2/3 of schools in England are using this to decide how to allocate school resources and what to do in the classroom. So if you've done a systematic review that appears in the informs the evidence portal, then you're informing the decisions of two-thirds of schools across England. That's enormous policy impact for a researcher to have. I've done a piece of research, my paper, it's been used by EF, and it's informing decisions being made by 2/3 of schools across the country. That's just phenomenal for a researcher to think you're having that much impact with your research. What works centres? There's, I think, 14 of them now. So here's an example. The crime reduction toolkit looks very similar. And I'll come back to this in a moment. So this is the evidence revolution. First wave, outcome one is results framework. It's good in putting results clearly in the spotlight, but not good at telling us what works. So second wave impact evaluation tells what works. Good to use an impact evaluation to inform local policy decisions, but you shouldn't generalize from single studies. You want to summarize the global evidence in reviews. That's the fourth wave. Now we've got all these reviews. How do we get the evidence used? That's knowledge brokering. That's the fourth wave. So what's Campbell doing? What's our role in the evidence revolution? So we do the so here's what we've got. We track policy influence from Campbell reviews. So we've often got cases where we can say we know a Campbell review has been used in national policy discussion, being an evidence portal would count as that. We know that it's been cited in the national policy document, or we have cases where WHO or other organisations have cited or used the Campbell review in their guidelines. So we've got all of these cases that we've documented in a brochure we're putting out very, very soon. So here's an example of a couple of pages from that brochure. We have a fairly recent review on class sizes. That review got quite a lot of press coverage, but also Education Down Foundation was having discussions around class size right by then with the teachers union in the UK, and they used our review in their discussions with teachers union to say, no, we stand by our view, there's no need to try and reduce class sizes further in England. And it's informed the research agenda. So other organisations have gone ahead and commissioned studies based on what this review has said. And then we have female genital mutilation, which is an example where WHO guidelines have been used this review in their guidelines. There are a couple of examples. So that's what's happening already, but we want to go more than that. And so here's what we do. We have plain language summaries like any organization. We're active in social media like many organizations. We emphasize more and more stakeholder engagement. So we encourage all of our review teams to have some stakeholder engagement. And some of our policy influence stories come from actually 3IE as a grantee requiring stakeholder engagement. We're looking for more and more demand-driven reviews where either we have a funder who wants a review or a map for a particular purpose, or we work with stakeholders to identify their needs to do a demand-driven review. But increasingly, and what I really believe in very strongly, is finding ways to institutionalize the use of evidence. And so that's happening. So we saw the teaching learning toolkit. That's currently not based on Campbell reviews, but we have an agreement with EEF by which in time, by with 3 years or so, all of those reviews EEF is using will be Campbell reviews. And with the crime reduction toolkit, already 14 of their items in their toolkit are informed by Campbell reviews. And as new reviews become available that are relevant to them, they will be using those in the crime reduction toolkit. It's actually true for crime solutions.gov in the UK as well. We have less relationship with them, but they're already using Campbell reviews as well. But that's existing what work centres who have picked us up or who we've gone to, we've worked with them saying, okay, let's build what we've got into what you're doing. But with new what work centres, we're working from the bottom up. We're saying, look, you want to build these high-level products like portals and guidelines. To do that, you need to make sure the base of the pyramid is strong. So what we need to do first of all is have evidence maps, because evidence maps tell us what's the current state of the pyramid. You can't build the top of the pyramid unless the bottom of the pyramid is solid. So are you going to build your evidence portals on solid foundations? So WHO, when it starts a set of guidelines, it first of all does a scoping study for existing reviews. And if there are no reviews or the reviews are out of date, then it commissions new ones. And if you read the guidelines on guidelines, WHO say doing guidelines take 2 years or 3 years if we need to commission new reviews, which is commonly the case. So you do this scoping, we do it as an evidence map, say what's the evidence base look like, do we need to commission new reviews or even new primary studies? So we're adopting this approach with the Centre for Homeless Impact, what works for homelessness. So we did an evidence map, here it is, and we used the evidence map to say, well, where are there existing reviews already we can summarize to go into evidence portal. I haven't got it here, but I have an evidence portal, and where there are reviews, we use those reviews to inform the evidence portal. Where there are no reviews, there are lots of studies, then let's commission those reviews. So CHI last year commissioned 3 reviews, which are nearly finished now, to inform the evidence portal. And then where there are no studies, in areas like employment and so on, for homeless people, there are no studies, then we need to encourage people or fund studies in those areas. So we've got a strategic approach now we're taking with the What Work Centres to say, let's first map the evidence, then let's identify the reviews that exist or need to be updated we can use to inform your portal. And where there aren't reviews, let's do those reviews. So that's institutionalizing the process for institutionalizing use of evidence into producing evidence portals. And we've done that approach of CHI. We've embarked on that progress with Youth Endowment Fund around youth crime. We're having discussions about doing it with Youth Futures. They're keen to do the approach on youth employment. We're already doing a map on youth employment for MasterCard. We've started discussions with UN International Organization of Migration, and we have a number of others ongoing, like the road safety one that I showed you earlier. So Campbell, I mean by that I mean the Campbell Secretariat is, and people in its staff, our staff in Delhi and Campbell South Asia, are heavily involved in this process and institutionalizing of evidence, and therefore driving up demand for having more and more Campbell reviews and maps that get published in the Campbell Library. Campbell is in the end a journal. So here's a question for you all as I finish. What will you all do in the evidence revolution? Here is the evidence architecture. And I have also on the left-hand side, with upward, the downward pyramid, the inverted pyramid, is the demand generation, is how you go out and actually get people to use evidence. I haven't spoken about that. I'm happy to do so in the question. So thank you for your time. Do go to our website. Do sign up to our newsletter. There's a big red button saying, I think it's orange, saying donate. You feel free to press that button and give us some money. But if you even don't do that, feel free to sign up to our newsletter. So I'm going to leave this slide on, and thank you. So let's take it over to questions.
Thank you, Howard, for this very interesting session. It was definitely very informative. We can start taking questions now. As we mentioned, you can either type in your question in the tab on the right, or you can use the raise your hand button and you can direct your question to Howard and we can unmute you. We have a question from Tamara Lutfi. I'm gonna unmute you.
Thank you, Zahra. Hi, Howard. Thank you for this great session.
Welcome. Thank you.
So Howard, actually, my question is about how much do you think the work and the the discussion that happened around the deworming work. And, it was it took a while, right, when this came out, and then the evidence was showing that whatever is implemented is not guided by the evidence. How much do you think a similar situation could actually raise awareness on the importance of using evidence syntheses in decision making? Thank you.
Right. So I think the people involved in that discussion in WHO were already aware of that, and even nationally. So we engaged nationally in India. We had an event where the relevant person came from the Ministry of Health and Family Welfare to a general event we had, but we had a session on deworming, and he said quite clearly that he understood. I mean, he clearly understood what reviews were, and he'd engaged with Cochrane, Cochrane South Asia, to understand what Cochrane was saying about this. And so the review that Vivian led for Campbell took the criticisms being made of the Cochrane review, and in the Campbell review took an approach to address those criticisms. So we thought we'd come out and we deliberately targeted review to, if people do school-based deworming, following WHO guidelines. So it was very clearly oriented to addressing WHO, and I think that was a very good process, and it did lead to a revision in the WHO guidelines, not in my mind as much as it should have been, but it was a change in what they were saying. And so I think the people involved in that discussion knew about the role of evidence synthesis. I think it had some benefits more generally in the international development community to highlight the role of reviews. There are detractors the people who so fervently believe that the Kenya study is right. And we're not saying the Kenya study is wrong. We're just saying other studies don't have the same finding. And they've tried so much to belittle and demean the review in unfounded and basically academically incorrect ways. I just don't understand what motivates them. But that's very specific to this debate. I do think the bigger answer, and this is really part of my mission, but I can't achieve this single-handedly, or even Campbell alone can't achieve this, is basically to get other organizations to do what WHO does. So no other UN organization does this. No other UN organization has guidelines that are based on systematic review. So they do publish guidelines, UNESCO, FAO, a lot of them publish guidelines, but they're based on expert opinion, bibliography review, having a committee, the things that WHO used to do 10 years ago. To reviews its practices and said, no, we have to base it on reviews. And so I somewhere, someone must be willing to fund a project basically to us to get WHO to roll out their model across the UN organizations. And education's the obvious one, because education where there are lots of studies, we have lots of reviews, and the Global Partnership, so UNESCO doesn't have much money, but the Global Partnership for Education has $12 billion to spend on what it calls evidence-based education programs, but it spends not a penny on putting in place the evidence architecture. And not a penny is a big exaggeration. It does some RCTs and on an ad hoc basis. It recently put some money aside to knowledge brokering, but has misspent it. So it's not doing it, not putting it in the right way. So the multilateral agencies, and the UN has no money, multilateral development banks, particularly the World Bank, but the global partnerships, which are often managed by the World Bank, have a lot of money. So global partnerships on funds against children, on education, you name anything, there's a global partnership on it. And they should be doing this. They should be building the evidence architecture, doing the evidence maps, identifying the gaps, producing knowledge-based evidence products. Now there should be particularly in Toolkit for the world where you can filter it. In the US, there's something like this for education, and you can filter it by students like mine. So you can be able to filter it for evidence from Africa or whatever, and see that. So it's doing knowledge portals that can be used by regional audiences. So actually, we are doing a project. We're not, but EEF are doing a project with a group in Cameroon called eBase to try and adapt the EEF toolkit to the African setting and do some locally relevant reviews to Campbell reviews to put into that toolkit. So I think the approach is getting sort of some recognition, but it's people don't understand the scale of what we're doing here. It's not huge. It's not huge. So I mean, GPS $12 billion. They could spend 0.1%, 0.1 of 1% of that. Yes, so 1,000th of a percent, yeah, of a percent on that, sorry, 0.11% on that. So thousands of their money or budget on that, and that they could build the whole evidence architecture. So it's a tiny amount of money in terms of what people are doing in terms of programs, but there's not enough organisations have the vision yet to say, okay, we're going to just systematically build the evidence architecture. It's going to take 10, 15 years to get there. If we don't start now, we won't be there in 10, 15 years time. We'll be in the same place we are now.
Howard, we have a question from Kulthum Sayed saying, please advise about the institutionalization of using evidence.
So it's part of what I was just saying. So it depends if you're asking that question from the point of view of an individual organization, or you're asking at the global level, which what I was just discussing. So for an individual organization, and I have advised quite a lot of organizations on how they can use evidence, what they should do to fund impact evaluations or use reviews and so on, is first and foremost, get the incentive system right. So in most bureaucracies don't encourage innovation, don't encourage people experimenting. Why is that? Because they encourage people to stay safe, do what they've always done, and they penalize failure if failure gets noticed and becomes known. So you must not penalize failure. You must penalize the failure to learn from failure. If you're going to experiment, then you need to actually recognize some things will fail. What we know actually is 80% of things don't work. Most things that don't work, we don't know they don't work because they're not being properly evaluated. And so we need to evaluate more things that people are doing already. We need to experiment. So we need venture capital funds for development programs, for social programs. The nearest we have for that is the Global Innovation Fund. So-called impact investing, which you think might be doing that, is just nonsense. It doesn't do this. It doesn't look at serious impact. So a lot of these global partnerships, a lot of social impact investment, even global partnerships, they have knowledge platforms, and these are based on, oh, you can share stories about your program, and someone can write in and say, oh, we're doing this women's empowerment program. Went to this program. This village met a woman who was given a bicycle by a program, and she tells me now she's really empowered. That's evidence of impact, and this is a program with billions of dollars. So come on, you can do something more than that. So organizations need to recognize they can experiment, recognize that you have to reward learning, not reward success. And the second thing is, of course, you need buy-in across the organization. So top level management buy-in is really important. When I started 3IE, one of the first workshops I did was in Delhi, and the staff that was for the DFID staff in Delhi, and the head of a DFID Delhi office started that workshop, opened it and said, a year from now, every person in this room has to have at least one impact evaluation in one of their programs. That was a great motivator for people to take part in that workshop and pay attention, and actually use that workshop to identify programs they would do impact evaluations of, and start thinking about the designs of those impact evaluations. So you need buy-in from the top of the organization, but then you need to build the capacity. So when I talk to bilateral organizations, I always said, you're going to start funding impact evaluations, you must employ someone that knows what an impact evaluation is. Otherwise, you'll just get taken for a ride by your consultant. You'll either have researcher capture by JPA and IPA who will do what they want, not what you want, or you'll have your usual consultants that actually don't know how to do an impact evaluation. They can just cut and paste enough into their proposal to make it look like they do. When it comes to it, they won't deliver. And so you need to have that internal capacity. So people that want to do this need to invest in the capacity. So you need to invest in the capacity to build evidence, and you need to invest in the capacity to use evidence. So DFID has a whole raft of knowledge brokers. The European Commission has been building up a cadre of knowledge brokers. They had a couple of events last year in Brussels I went to on basically what do you need to be a knowledge broker, what are the skills required to be a knowledge broker. So get incentives right, get buy-in across the organization, and to invest in the capacity for both producing, commissioning, and using evidence. That's for an individual organization. And then think how you're going to use that evidence, build it into your systems. So if you make a proposal at DFID, you have to say in your proposal, what evidence is this proposal based on? So you can't get it funded unless it's based on evidence. And if you say there is no evidence, then you have to show how that proposal will generate evidence. International Rescue Committee has gone to that system. International Rescue Committee pledged that by 2020, by this year, all of its programs will be evidence-based or evidence-generating in the same way different systems have been using. If you fill in a proposal for the Gates Foundation, for years it said on the proposal, what evidence of systematic reviews is this proposal based on? So you institutionalize your evidence in that way in your organization. Or you go to evidence portals to say, are we funding what works? The Dutch NGO Novib some years ago commissioned a portal on WASH to say what WASH interventions work, to see if they're doing the right thing. When it was produced, they then said to consultants, okay, you can't go in the public domain with this because most things we're doing don't work. So let's wait 6 months, we'll switch our programs to those that do work, then we'll go public with this. So as an organization, there are lots of things you can do. Globally, we need to do what I was saying in my last answer. We need to get the global organizations, UN, global partnerships, multilaterals like the World Bank, basically building the evidence architecture in a systematic way. Preferably all as Campbell reviews using research from the Jesse Research Network. So I'm done, but I can't hear anything now.
Howard?
I'm here.
Yeah, I think we lost you there. Um, we had one last question from Megan Lloyd saying, what are the challenges of evidencing the impact of Campbell's work in policy and practice, investment in the future, and research?
Okay, Megan, thank you. So that's the slide that I pulled up. So until recently, we weren't tracking this. So now we started to track what we call policy influence stories, and this is similar, as you know, that what I did at 3IE, which was what I call it policy influence monitoring, because these are not counterfactual statements. The statement we seek to make is an action was taken or policy or practice was changed or stopped in a way that's consistent with what the evidence suggested and what the findings from the study suggested, because that's the strongest statement we can make. And in the absence of an in-depth qualitative research on the reasons behind a decision of the sort that 3i did do for a small number of its studies, we can't say really what the role was. And sometimes we have a better idea and a stronger idea, and other times we're not so sure. So we're looking for cases in which we've got citations in policy documents, we've got citations in guideline documents, or we have a verbal case of use of evidence by one of the users. This has been helped greatly by altmetric. So Campbell Library has an altmetric score. An altmetric, as you know, is tracking non-bibliographic, non-academic citation importance of review. So it tracks social media, but importantly tracks citation policy influence documents. So when we got the altmetric data for the first time around 6 months ago, I went through those and roughly doubled our policy influence story number from those data. But we also had ourselves a dozen cases that they hadn't got. So altmetric isn't fully comprehensive. And so we look for these cases, we monitor them manually, basically. Because when we're working with a user, like we're working with CHI, we're working with EDF, we're working with youth endowment, then we know what the use is, and so we can put that into our policy influence stories. But otherwise, we have to go out and find it. So we have to manually search for it. But even at 3IE, there's in my time there was someone whose job it was to basically hunt the web for these stories, because some of them came through the policy influence monitoring, the reporting that grantees are required to do, but a lot of it didn't come that way. So at Campbell, there's not been the history of doing this. The social welfare group did do a survey, author survey, 3 or 4 years ago, and we did one at Campbell. They did one at Campbell when I started, so that's 4 years ago. The social welfare one is probably 5, 6 years ago, where they asked authors about policy influence. Most of the authors had nothing to say about that. So authors aren't necessarily the best people to answer this question. That's actually a good point, because at 3IE, I mean, I talk about 3IE because my experience of this is strongest at 3IE. We found the policy influence was greatest from our primary studies, not our reviews. And that was because That's because with a single study, you have a policy audience. Single study policy audience is the implementing agency doing the intervention you're evaluating, and you have to speak to them to do the study. So you've got stakeholder engagement of necessity in a primary evaluation. Doing a review, you can just sit in your ivory tower, never speak to anybody. Just, you could do that. You shouldn't do that, but you could do that. So there's no need to have this policy engagement. But we require it. I mean, 3i required it. So it's actually Vivian who tells the story quite nicely. It's better than I can do, of the school feeding review that she worked on with Betsy Christensen, which was funded by 3IE, published by Campbell. It requires stakeholder engagement. So they went to the World Food Programme that funds gives food to a lot of school feeding programs, or funds now a lot of school feeding programs, and engaged with them. And so it actually did inform WFP guidelines from that review because of that requirement of ex-ante stakeholder engagement. And so we do, by requiring ex-ante stakeholder engagement, or at least encouraging it, we can't always require it, encouraging stakeholder engagement with teams in our camp reviews, we hope to get more, be able to capture more policy influence stories and actually have more policy influence, but also capturing all that through that. So today we have the evidence I presented earlier in my presentation, which is in this bar chart here. This comes from a brochure that will be published next week, hopefully. So it's coming to an email near you soon, or be on our website, where we present, as of sometime last year, the policy influence stories that we have at that time, and you can read there that they are the stories like the ones shown here, where we tell you what the review was, and we tell you where, in very brief terms, what we know about it. We have a longer document which describes it in more detail, but here is a very brief summary of what those stories were. So this is crucial for us. We did this because we want to go reach out to potential funders of Campbell and say, we're a good organisation, we have a lot of influence, please give us money. But we think this is very motivational for reviewers. We've started to write to all review teams who are in this brochure, saying, hey, your review had policy influence, you're in this brochure, and telling them. But to come back to reviews, so reviews don't have this natural policy audience. So I recently updated the policy influence tracking, and recently I mean like 2 weeks ago, the policy influence tracking for the first ever review we did at 3IE. It's the WASH review that Hugh Waddington led. And that's got 12 cases now, I think, of policy influence tracking. And in the first 3 years, it was nothing. There was nothing coming through. But now it's cited in DFID, DFAT, WHO, UNICEF, World Bank. It's all over the place. It gets cited. And so reviews can take time to come through in a way that that the primary studies don't. But we try to reduce that time by engaging with stakeholders. But I do think the high profile reviews, like actually I think class sizes, FGM, which is updating, will get picked up because they're on issues people want to know about, and they find them because when they look for what the evidence is, they do find the Campbell reviews.
Okay, great. Thank you so much, Howard, for this and very interesting presentation. It was definitely great, and I'm sure the Gussie Network is always ready to collaborate with Campbell. I want to thank you again. As for the attendees who are with us, just make sure to follow us for other sessions for the Gussie webinar series, and thank you.